dietary factors and other things that people have raised in their questions tonight. Okay, I'm trying to move. Right, hold on a second. I think I need to move it from here. Yes. So as loads of people here know, thyroid eye disease can be extremely distressing. And I don't think people generally appreciate how distressing it is until they actually go through it. TED is an autoimmune disease, but what I would like to talk about is what is an autoimmune disease, because people keep talking about these things and perhaps not everybody is quite clear. So we all have an immune system, some of us better than others. And this immune system is normally guards against things like viruses, bacteria, fungi, parasites, and unfortunately all those things also produce a lot of toxins. And normally a sort of normal healthy immune system can tell the difference between what is foreign and what is the body's own cells. So therefore only selectively attack the foreign stuff and not the body's own healthy cells. And there are many organs and many parts of the body, such as the spleen, the thymus, which is a gland somewhere in the chest, and a lot of the lymphatic tissue in the guts, bone marrow, and so on, that contribute to this immune system. We all have two very important separate parts of the immune system. So one is called innate immune system. So that's the one we are born with. This is a rapid fire system. So bacteria goes in, or virus or parasite goes in, and the killer cells in this immune system immediately go around it, surround it, and neutralize it. So these cells are called phagocytes. And then the second, this is not so important for autoimmune diseases, but then the second system that develops after we are born is called adaptive immune system. And this is the one that works through antibodies, which are molecules that neutralize or bind to certain parts of bacteria and viruses and so on. And these antibodies are developed after the body has been exposed to the invader, and they stay in the body. It can take several days or weeks for them to develop, but after the first exposure, once the immune system comes in contact again with a similar bacteria or virus, it triggers more production of these antibodies a lot quicker. And so this acquired immune system changes throughout one's life. And very importantly, the two systems work together. Sorry, I need to change two things on my, yeah, I'm not as high tech as other people are. So what are autoimmune diseases? Well, in an autoimmune disease, our immune system, or the patient immune system, mistakenly attacks parts of the body because it recognizes them as foreign. So say, okay, you're not belonging to me, I'm going to neutralize you. And anything, almost anything can be attacked in this manner. So things like the joints, the skin, the thyroid, because we are on a thyroid meeting. And in this graph, I have various quite common diseases that are all autoimmune. There are very many of them related to different parts of the body. So if you take just the thyroid, which is a small part, you've got three conditions like thyroiditis, Hashimoto, and Graves' disease. They are all autoimmune. You have rheumatoid on the bones, You've got several skin conditions, and I'll talk about some of them a little bit later. So autoimmune diseases affect an awful lot of people. They're very common, I think, and interestingly, they are more common in women than in men. I don't know how many male patients we have tonight in this meeting. There seem to be a lot of ladies, but definitely a lot more common. So overall, I think it's a 2-to-1 ratio. So for every man with an autoimmune disorder, there are 2 women suffering. And interestingly, quite often they seem to start during childbearing years. So hormones and so on have been blamed for part of this. I'm sorry, that's my daughter crying in the background. Risk factors for thyroid eye disease that I would like to touch on tonight in the context of autoimmune disease are things like genetics, previous history of autoimmune disorders, gender, age, pregnancy, hyperthyroidism. I'm not gonna probably go quite quickly over this because BJ spoke quite a lot about it. Circulating antibodies, various treatments and drugs, and environmental nutritional factors. Right, so clearly genetic factors play a role in the thyroid eye development. There have been studies done on twins showing that identical twins that basically are genetically the same have, if one has thyroid eye disease, then likelihood of the other to have thyroid eye disease or developing during the life is about 30%. So compared to non-identical twins, where only 3% developed thyroid eye disease sometimes during their life. Also, when asymptomatic family members of patients with thyroid eye disease were examined, many had early signs of thyroid eye disease without having any systemic thyroid abnormality. And this ties up with the previous discussion about people thinking of thyroid eye disease only when patients are hyperthyroid and not necessarily otherwise. So perhaps for us professionals, it's important to ask about these things. And by all means, not every family member will necessarily have the same disease. So not everybody will have grapes. Some people might have thyroid eye disease, other people might have, somebody in a cousin could have rheumatoid and so on. So we find quite often if you dig deep and ask patients, they might know somebody in their family with a condition that's classed as autoimmune. So we think that people inherit a susceptibility to an autoimmune condition, and this is called a genetic susceptibility. And this is important because other factors on top of this can trigger the disease. I think a lot of time has been spent in labs and so on trying to identify which genes in particular might cause someone to be susceptible to developing thyroid eye disease. There are studies on what is called the HLA system, which is related to immunity primarily, but overall the specific genetics are poorly understood. So we know there is something there, but we can't exactly pinpoint what it is, like many other things in thyroid eye disease. What sort of autoimmune diseases we might also find when people have thyroid eye disease? So things like type 1 diabetes, where the cells producing insulin are attacked, then Addison disease, and you can see the changes in skin related to Addison with folds, hyperpigmentation, and nail changes. Primary gonadal failure, this affects the sex hormones. Hypophysitis, this is a condition that inflames the pituitary gland, which controls many of the other glands, regulating hormones and producing them in the body. The Hashimoto thyroiditis is an inflammation of the thyroid glands. And then you can also have non-endocrine autoimmune conditions associated with thyroid eye disease. So things like pernicious anemia, and it is sort of strawberry tongue related to that. Myasthenia, maybe some of you have encountered that when the transmission of nerve signal from the nerve to the muscle is impaired, and that leads to sort of face, everything sort of seems to droop. People can experience double vision. That can maybe make it confusing with thyroid eye disease as well. And this is also treatable, which is good news. There is association with celiac disease, which is gluten intolerance, and also well, here's another, I'll come to that later. Vitiligo is basically when pigmented cells in the skin are attacked and patients develop this patchy bleaching of the skin. And the same, alopecia is attacking the condition attacks the hair follicles, and then you end up with patches of bald skin on the scalp. Rheumatoid, very well known, and things like immune thrombocytopenic purpura, which attacks the clotting system, and patients develop these sort of bruises and areas of little blood clots under the skin. So it's quite interesting because for a normal lay person, you never think that what happens to your eye has something to do with what happens to your joints, or has anything to do with what happens with your hair. And it would be really nice to know how these things are connected. So we observe that they are connected, but we don't necessarily know why. As I said, thyroid eye disease matches the rest of the autoimmune conditions, such as it's a lot more common in women than in men. It's actually more common than others, so 6 to 8 times more women than men develop thyroid eye disease. And if you look at sort of other articles, I found anything between 3 and 10, so it's quite a bit of variation over there. Seems to be that pregnancy and recent childbirth can increase the risk of developing the condition in people who are genetically susceptible, so then the group that we spoke before. And interestingly, thyroid eye disease has 2 peaks. So it's got a peaks into the sort of 30s and another one late 60s. And also, I think it's more for Sarah and her mom developing thyroid eye disease quite late in life. So patients who have, so older patients seem to almost skip the severe inflammation initial stage, but develop a more subtle disease that progresses with more scar tissue developing in the orbit on the muscle, and that's difficult to treat. So the reason I put this Rundle curve, which is a doctor that described the clinical course of thyroid eye disease sort of 100 years ago, is because if you follow this, then you should get very inflamed in the active phase and then reach a stable phase, which is the one in which ideally people have the corrective surgeries and so on. But what we actually see in clinical practice doesn't always fit this. We see more people and I remember in Bristol, and definitely I have at the moment one lady I can think of in the clinic who had her Graves, had the thyroid removed, and it was 4 years later, being completely stable for 4 years, she developed the thyroid eye disease. And why would that happen? We do not know. She had all the treatment, the thyroid functions perfect, and then 3 months after stopping the steroids, she relapsed again. So we see a lot of people, and I think Rebecca probably can think of a lot more than I do, following an unusual course of disease that doesn't really fit this curve. Right, so this is a very busy slide, and I apologize for that. So talking about how many people develop thyroid eye disease when they suffer with Graves, hyperthyroidism, so overactive thyroid, or even underactive thyroid. And it's quite a high percentage, it's between 25 to 50% I found. And out of those, about 3 to 5% will develop a moderate to severe thyroid eye disease that grants treatment. And what the most commonly patients are hyperthyroid, about 8 out of 10, about 1 in 10 are hypothyroid, and probably the other 1 in 10, the thyroid functions totally normal. And to just give an idea how complex this condition is, these are all the sort of little factors and molecules that are implicated in, that we know of at the moment, in inflaming the thyroid, triggering thyroid eye disease, making the muscles big, and giving the symptoms. Okay. Sorry. So what is quite interesting is that we don't know why thyroid eye disease develop, but once it develops, it seems to be a separate process from the initial thyroid inflammation, with very little interaction between the two. And here, again, I can mention the patients that have very well controlled thyroid hormone levels, but then their thyroid eye disease is not any better and continue to progress. However, what we do know is that in patients who develop thyroid eye disease, if the thyroid hormone levels are not well controlled, that's having a poor prognosis. So it will make the thyroid eye disease worse, and particularly bad seems to be when people are up and down trying to have this control of the thyroid hormones. It's almost like a yo-yo effect that seem to be not faring well. And those are the patients we regard as higher risk, and we are monitoring them more often. So although we try and find out all the time the reason for thyroid eye disease starting, it's still unclear why patients with a thyroid hormone abnormality develop the eye disease. So going back to antibodies and autoantibodies, the Graves' disease is clearly an autoimmune disorder in which antibodies to the thyrotropin receptor results in activation of the receptor and increased level of the thyroid hormone. Now, the circulating antibodies to various thyroid-related proteins are responsible for manifestations of Graves, which results in hyperthyroidism. So these antibodies target autoantibodies target thyroid-related protein in the thyroid gland, in the orbit, as well as other connective tissues in the body, such as sheens. And this leads to swelling, for example, and the pretibial edema called mixed edema that's described as well. And out of all these hormones, the TSHR stimulating or TSI receptor seem to be particularly important in the thyroid eye disease. So there were studies in which they actually found the level of about 400 of the TSI that correlated with how severe the thyroid eye disease was. And also in some studies, they found that it perhaps can predict some of the patients who develop and how severe the thyroid eye disease is going to be, although probably more work needs doing for that. So the TSI causes things like bulging, inflammation, the dryness, and with that pain and impaired vision, and the double vision that patients with thyroid eye disease develop. So apart from the signs in the thyroid, inflammation causes this diffuse goiter, the localized swelling on the sheens, the inflammation in and sort of thickening of the lymphatic vessels, which normally drain fluid, and also changes in the nails. And interestingly, the nail changes are not typical for thyroid. There are many other autoimmune conditions coming with nail changes. So it seems to be an area quite affected by autoimmune conditions. In terms of medication, I'll go very quickly through this because BJ already spoke about it. Many things are used, well, now a number of categories of drugs used to treat hyperthyroidism, but the one that we know it can worsen or trigger new thyroid eye disease is the radioactive iodine. And the reason for that is that is absorbed into the thyroid gland and cause some of the cells to die, and that causes a lot of inflammation, and is the inflammation that worsens the existing thyroid eye disease and also increases the probability of developing new thyroid eye disease in patients who didn't have any previous issues. And some studies suggest that by giving patients steroids prior to giving the radioactive iodine could reduce the risk of new thyroid eye disease developing or existing thyroid eye disease getting worse. Other drugs involved in triggering thyroid eye disease are things like interferon, that's sometimes used for things like treating hepatitis, for example, some of the HIV medication, and this Campaz monoclonal antibody that's also used, that's used for to treat multiple sclerosis. Now, many of these things we cannot change. We cannot change the genes we are born with. We cannot change what autoimmune condition our mother might have had. We cannot change the fact that we are born as women, but what we can change is smoking. And we know that this is the biggest environmental risk factor in developing thyroid eye disease. It increases the risk of severe eye disease by 3-4 times. Also, it increases the risk of visual loss. In terms of orbital inflammation, the molecules in the tobacco produce additional inflammation, and this has been proven to significantly worsen the disease by up to 700% in one study, so 7-folds compared to somebody who doesn't smoke. That is extremely significant. And the risks seem to be directly related to the number of cigarettes smoked and is reversible. So with the right support, if people can manage to stop or reduce their smoking, that can lead to milder disease, visual improvements. So I think the message out of everything that I said tonight that I would really like people to remember is that it's never too late to stop. Now, and in more recent research, focused on the gut microbiome and what is called the leaky bowel. So we all have trillions of bacteria, microorganisms on our skin, inside the body. Actually, we have something like 10 times more bugs in our gut than all our cells together. So it's almost like a separate organ that produces and facilitates processes, absorptions of nutrients, modulates some of the hormones. And a lot of research has focused on this in the past few years. And many diseases, including cancer, autoimmune diseases, have been somehow related to this gut microbiome. And the gut microbiome synthesizes hormones, regulates their release. But what's quite important is modulated by diet. And I'm sure that Karishma is going to be quite happy to see this slide up. And for example, in patients having eye inflammation called uveitis related to spondylosis, ankylosing spondylitis, and this HLA-B27 immunity thing, it is been proven to reduce the inflammation, but just changing the diet. So, you know, we are getting there. We are catching up with what's happening in the body with the bugs. So composition of this gut microbiota can be modulated by endogenous and exogenous factors, the factors from inside the body and outside the body. And things that have been proven recently to be important are factors related to the mother. This is for babies. So, for example, babies who are born by C-section, they have different bugs. They are colonized with different bugs compared to the ones which are born vaginally, and those bugs tend to be nastier and put them at higher risk. Babies who are breastfed, they have different bugs in their intestine, in their gut, compared to the ones who are formula fed. And again, it seems to be that nature got it right. So the breastfed ones tend to have some protection and nicer bacteria protecting them compared to the others. The administration of antibiotics will change this gut microbiome, but also things like the host genetics is a two-way interaction, the immune response as well, and the environmental exposure. So in terms of research specifically focusing on thyroid eye disease, the gut microbiome has been suggested to be implicated in thyroid eye disease development. And one bacteria that has been associated with this or identified is this Yersinia enterocolitica, which causes inflammation in the gut. When the immune system mounts an attack against such bacteria, there are antibodies that can cross-react with the thyroid gland and related tissues. So the body intends the antibodies to fight this particular bug, but as a side effect, they also attack the thyroid gland and related tissues, leading to worsening of disease. And the theory about the role of gut microbiome in thyroid eye disease is also supported, according to some people, by the fact that thyroid eye disease and intestinal, so gut diseases, they coexist quite often. And the thyroid inflammation diseases, so Hashimoto and also Graves' disease, often occur in patients who have celiac disease or non-celiac with sensitivity. So it's a little bit what Karishma said, that she's not a celiac patient, but she identified that she might have an intolerance and changing her diet helped. So there are some studies supporting this. And the explanation is that a damaged gut barrier followed by an increase in permeability, which means that there are more stuff from the gut, including toxins, that are able to cross into the body and into the blood, contribute to an activation of the immune system or cross-react with tissues outside the gut. Also, the composition of the gut microbiota has an influence on the availability of essential nutrients for the thyroid gland. So things like iodine, iron, copper are crucial for thyroid hormone synthesis. Selenium and zinc are needed to convert the T4 to T3, and vitamin D assists in regulating the immune response. And vitamin D has been also quite intensively researched in the past probably 5 to 10 years, because it has complex effects on immune system, and it is likely to affect the thyroid through immunomodulatory effects. For example, there was a study, and it's not just related to thyroid, it's related to other conditions. For example, in children developing type 1 diabetes, if they have a vitamin D deficiency, they are 70% more likely to develop diabetes than otherwise. Other studies found that the micronutrients, so things like selenium and iron and vitamin D, are found to be lacking or not being there in sufficient quantities in people with autoimmune thyroid diseases, contributing in the malfunction of the thyroid. And this leads us to the next risk factor, which is the nutrition factors. Well known probably to all present at the meeting that selenium is, we recommend supplementation, particularly when patients have mild thyroid eye disease. Is a trace mineral, so it's found in small quantity, very, very small quantities. However, if you like Brazil nuts, it's a good one because Brazil nuts have a lot of selenium. So for those not liking tablets, Brazil nuts are a nice substitute. Was found to be deficient in patients with Graves, hypothyroidism, and thyroid eye disease. And luckily, it's something that we can supplement. a vitamin D deficiency, so pre-existent vitamin D deficiency causes an inflammatory, a pro-inflammatory state, and vitamin D has an anti-inflammatory effect, and it's not quite 100% clear why that happened. But if people have pre-existing vitamin D deficiency, it makes them more prone to develop thyroid eye disease. Now, one of the theories that the development of thyroid eye disease has consumed these vitamins and minerals, such as that the low levels reduce the production of anti-inflammatory protein, and supplementation of things like vitamin D as well might help the course of thyroid eye disease. I mean, considering that we live in England and a lot of people are deficient in vitamin D, particularly north of Birmingham, and also is more commonly found in people with darker skins of Asian or Black origin, because their skin absorbs less sort of solar radiation, converts less vitamin D to a very active form. It probably makes sense for most people to take it. And considering we are in a COVID pandemic, it's also been recently recommended by the Public Health England pretty much for everybody, because again, it increases the ability of the body to fight infections, including COVID. One factor that has been described and is again unsure how it affects thyroid eye disease is related to emotional and physical stress. So the development of thyroid eye disease has been associated with stressful life events that can act as a trigger in susceptible people. That's probably also through immunity, and we know that stress upregulates cortisol and causes dampening of the immune response, and that has been described in other conditions. So to summarize, things we touched upon risk factor wise are genetics, history of autoimmune disease, gender, age, pregnancy, thyroid diseases, circulating antibodies and medication, anti-hyperthyroid treatment, environmental factors, drugs, and emotional and physical stress. I feel really bad because I'm feeling I've been talking for the past nearly half an hour, but still it is quite unclear which factors trigger the onset of thyroid eye disease in a patient with Graves' hyperthyroidism. But we are searching to elucidate these factors in a hope that they will allow a more accurate prediction of who will develop it and allow for an earlier treatment. Thank you very much. Thank you.